Doctors of Reddit, what's it like when you go in for a doctor's appointment? Do you and your doctor discuss what's wrong with you like it's a group project? Do you not go at all because you're your own doctor? Doctor here, family medicine. I self-diagnose most things, but for my 1-year-old daughter I decided a while ago that I don't want to do that for her. So her pediatrician doesn't know I'm a doctor. I never told her. I want her to treat me like any other parent, and explain everything to me like I'm 5 years old. I'm afraid of being too nonchalant with my daughter's health that I'll miss something, or the doctor assuming I know more than I really do. It's actually a strategy I've adopted since on myself. If I go to a doctor, say a gynecologist, for a routine checkup, I sometimes just don't say what I do so I can legitimately ask dumb questions about things that I should really know, or so that the other doctor won't leave out important info that they assume I know for fear of insulting me. On the other hand, my regular doctors do know, such as the gynecologist who saw me through my pregnancies, and that enables more complex and nuanced discussions about health decisions, as in debating questions and giving me options that he wouldn't necessarily do with it. He patients. BC he can be sure I understand the medical pros and cons well once I'm given a basic explanation. Doctor here, neurologist. I'm not good at going to the doctor. I don't go often, but when I do I usually just STFU, especially if it's a field of medicine I have no idea about, like say, derm. That being said, the doctor usually knows I'm a physician as well, and so the language terms to be more technical. I also find that we practice less defensively with each other since we can be more open. We could do ABC tests, but honestly what you probably have is X, so take this, and if it doesn't get better then we can do ABC. Real question is, do you understand the prescription the other doctor writes? I'm an ER doctor, and sometimes I have other doctors as patients. For the most part they're pretty good patients because they can give a good description of their symptoms in a way that's useful to me. They usually ask good questions and are well equipped to have an informed discussion about their diagnosis and treatment. Sometimes it's hard for me to dial back my patient talk where I simplify medical terms for lay people. Sometimes it's challenging if their area of expertise is totally unrelated to the issue at hand and they don't recognize their limited understanding. The worst patients are those who have just a little medical knowledge and think they know everything. Some version of, my aunt is a nurse, and she said I need a whole body MRI for this runny nose. As far as self-diagnosing, I usually deal with my own minor medical issues. If I notice signs of something more serious, I would go to someone else. Doctor here. In general, we are not good about going to the doctor. For me it's physicals about half as often as recommended, and that time I had strep a year and a half ago that didn't resolve with whatever antibiotics I had in my medicine cabinet. When we do go in, it is like a group project. We usually hash things out together, but ultimately I am going to defer to someone with more expertise than me in that area who can make an objective decision. When I go to the doctors it's also like a group project. I let everyone else do the work and reap the benefits. I was at a lecture a couple of years ago, performed by 2 doctors who'd undergone treatment for breast cancer and written a book about it together. I remember her talking about her diagnosis. She was a breast cancer surgeon herself, you couldn't make it up. She walked into the room, saw her own scans with the doctor, and her heart dropped. She barely heard a word he said because she couldn't stop the flood of information she was getting. Looking at the scan she knew if she'd need surgery, chemo, radiotherapy, how long it would be, what her estimated survival was. I don't think they discussed it like a group project, but I suppose she couldn't stop herself from listening to her own internal monologue since it was her own field. I remember her saying she'd found it, in hindsight, an incredible learning opportunity regarding how to interact with patients, and that she thought about it a lot. Both my parents are doctors, and they see each other as their doctors. For their situation, they don't make appointments for anything, so if I or they get like the flu they just write a prescription. If they need specialists, they usually tell them they are doctors and they get better treatment like skipping lines or whatever, or they know each other already so it's chill. I'm sorry this kinda sounds spoiled, but it's my experience. Sounds awkward? Looks like you picked up an STD. I prescribe a divorce. MS3 medical student and my dad is a PULM/ICU doc. Growing up I only ever went to the pediatrician until age 11 to get the standard PEDS vaccines. Otherwise, I've never went to see a different doctor. If I ever got sick, my dad would just diagnose it, write a script, and have mom pick it up. Physical exams for sports, university etc. were just signed off at home as normal. My dad has been practicing for 25 years and he has never actually scheduled a doctor's appointment. If he ever had an issue, then he would just write a script for himself. If it was something that he couldn't do himself, i.e. drain a pilonidal cyst on his cheek, lol true story, he would just have his surgeon buddy come to the house and do AID in the living room for a bottle of whiskey as barter. He's definitely his own doctor. As a veterinarian, many of my worst clients are nurses and doctors. Lots of questionable home diagnoses and treatments. Yeah, people and animals are pretty close, but we're not the same and medicines don't work 100% the same. I agree about having difficulty dialing back the patient talk though. These are folks that can understand medical terms, and I don't want to be demeaning, but I've got my dumbed down spiel about things and it just flows out. To be fair, I recognize that I'm probably annoying to my doctor too. Although when I went in for surgery last year I had a great time chatting with the anesthesia nurses about protocols until they drugged me. My whole family are doctors, I'm not, and I went to one DR who told me, I told my DR wife to stop diagnosing our kid and overreacting to everything. Turns out she had pneumonia. And on an unrelated note, couches are not comfortable to sleep on. My sister-in-law is a pediatric oncologist. When she was pregnant with her first, mine were teens at the time, maybe one already in college, she was so nervous. I told her she shouldn't be that nervous, she was a wreck, because she was a pediatrician. She said she only knew what to do with the sick ones. Laughing face, great mom, has had more since then. I was sat in a consultation between two doctors with one needing an ultrasound. They knew each other through work already, so it was very friendly and casual between the both of them. The patient doctor trying to figure out what was going on the ultrasound screen, and the doctor was teaching him the bits he didn't know. My dad's a doctor, and he said he'd stay up till 2 or 3 a.m. discussing medshul topics with his roommate, sorta for fun, and also for the obvious benefit. Greatest doctor call of all time. First, paramedic here, not doctor. Call for chest pain, side of the road. Guy pulled over to call 911, not local, just passing through. While my basic is slapping leads on I'm getting some history, guy is obviously well educated, knows his stuff and just speaks the lingo. I run at 12 lead, it's bad. Not end of days, just hey let's get the cath lab wound up and drive real fast. It's also a little odd. So I decide to flip it, 15 lead, flip it again, do a right side whole time we are making tracks to the ER. Guy asks about nitro and I start explaining that certain types of heart attacks can be made much worse with nitro. He asks to see his strips. Humor him, hand them over while I'm calling in my report. He thanks me, say I'm right, it's anterior etc. and he's going to need XYZ bypass etc. Freaking cardiologist. Coolest, most laid back PT ever having a freaking heart attack, and starts explaining to me about the surgical process he's about to be under. Dr. Here, it is a bit dependent on the field of medicine involved. For example, I don't know much about neurological issues, so if I went to see a neurologist I certainly wouldn't be chipping in. For more generic conditions I have previously offered my thoughts to my doctor about what it could be. Ultimately I still go to the doctor as they can prescribe drugs/order tests for me that would be difficult/questionable for me to do myself. Your answer seems to be the most genuine and reasonable answer yet, Ty.